Hi, David McIntosh from ENT Specialists. Do you often wonder how much tonsillitis you need to put up with before someone will take your tonsils out? Well, in the days of the past, a lot of people had their tonsils out simply because they still had their tonsils in. There was even a hospital in New York that was dedicated completely to removing tonsils back in the 1930s. Now, things have progressed a little bit since the days of just taking them out for the sake of it, and we do have some good guidelines. When it comes to tonsillitis, we look at the frequency and the severity. When we look at the frequency, essentially what we want to do is make sure that we're not getting in too early, because it's normal to get sore throats every now and then. And when it comes to tonsillitis, which is not just a sore throat but actual infection of the tonsils themselves, we like to count them off in terms of a time frame of years. So if we're looking at 1 year, then we're roughly looking at around about 6 to 7 attacks within that 12-month period, where we say, you know what, fair's fair, enough's enough. It would be nice if it had settled down by itself. Given that it's been ongoing, it's quite debilitating, you're getting sick roughly every 8 to 9 weeks, it's probably reasonable to look at getting things sorted. Or alternatively, we look at around about 4 to 5 times a year spread over 2 years, or if you like, 8 to 10 times over a 2-year period. Again, that means you're getting sick roughly every 3 months or so, and again, you sort of go, all right, we're getting to the stage where enough's enough. And then thirdly, we'd look at approximately 9 to 10 cases spread over 3 years. And if you get to that sort of stage again, it means you're getting sick roughly every 4 months or so, and we say, okay, enough's enough. Now, what's the difference between a sore throat and tonsillitis? Well, the throat is everything. It's inside your mouth, it's your tongue, it includes your tonsils, back of the throat, and then down lower part of your throat as well. Tonsillitis specifically is an infection of the swellings that sit on the side of your throat called your tonsils. And there is a difference between sore throats and tonsillitis. Sore throats can be things that have got absolutely nothing to do with infection whatsoever, whereas tonsillitis is infection. And if that infection is significant, needing the point of antibiotics, then yeah, we start looking at that in terms of whether it's time to get your tonsils out, depending on how many attacks you end up having over the time periods I mentioned. Anyway, that's just a rough guide for you. As with any surgical procedure, there are risks involved, so this is the sort of thing that your specialist would discuss with you. But I just want to give you some insight as to give you some guidance when you sort of get to the point where enough is probably enough. There'll be a video about snoring in kids. It'd be worth looking at that, because having talked about tonsillitis in children, with regards to taking tonsils out, actually tonsillitis is less common these days as a reason, and snoring is far more common. But you can jump over to the snoring video in kids to learn more about that. Have a good day.